Canada's Advisory Committee on Immunization is recommending Canadians roll up their sleeves for another COVID-19 booster shot this fall. With more on this, we are joined by Infectious Diseases Specialist Dr. Bogoch. Thanks so much for being with us today.
My pleasure, Sonia.
All right, I think we're kind of at that point where a lot of Canadians have lost track of how many boosters they've had, how many shots they've had. It's maybe a little bit out of sight, out of mind. Why is it important to get this shot?
Yeah, I think it's fair to acknowledge that if we look at where we're at right now in Canada, the rates of COVID are much lower than they were many, many months ago. When we see that through dropping hospitalization rates, through low wastewater surveillance data. But of course, we know it's still here. And sadly, people are still becoming infected. And sadly, we're seeing usually the more vulnerable populations impacted by this more significantly, and those who are overrepresented in, for example, hospital stays. But, we know that we're going to see a rise in cases at some point, likely in the fall. And of course, we know some of us are more vulnerable to COVID and more at risk for severe manifestations of the virus, like hospitalization, intensive care unit stay, or death. And it's extremely important that people, especially those who are at greater risk, get a vaccine at the appropriate time. That's going to roll out in the fall, and it's very important that people who are, especially those who are at greatest risk of severe infection, get that vaccine.
And who are those individuals that are at greater risk?
So the National Advisory Committee on Immunization came out with this document a couple of days ago, and they really outlined the traditional risk factors for COVID-19. Age is probably one of the most significant risk factors, and they suggested that people over the age of 65 get a booster vaccine, regardless of what you've had in the past, and they come out for a booster vaccine when these vaccines become available in the fall. They also suggested that people who live in long-term care facilities get a booster vaccine. There's many people who have underlying medical conditions that put them at greater risk for severe infection, and then a few other cohorts as well, certainly Indigenous communities and other cohorts as well that are at greater risk for severe manifestations of the virus. And again, we'll probably have a newer vaccine available in the fall, and it's very reasonable for people who are at risk for severe infections to go out and get that vaccine. In fact, the National Advisory Committee on Immunization made a strong recommendation that those individuals get a vaccine. It makes a lot of sense.
All right. Now, I understand that the formula for this vaccine could be a little bit different. I understand that you'll be watching what happens in the Southern Hemisphere to basically be a bit of a preview of what we could expect here in the fall.
Yeah, well, with the COVID, with the SARS-CoV-2 or the virus that causes COVID-19, we know that this virus changes pretty significantly. It mutates, it changes with time, and the vaccine that's likely going to be rolled out in the fall is likely going to be something called an XBB vaccine, and that's just more reflective of the circulating variant at this time. When we talk about influenza vaccines, which are also going to roll out in the fall for the annual flu shot, that's also very important to watch. And certainly the Southern Hemisphere is in the midst of their influenza season. They have vaccine campaigns in many South Hemisphere countries, for example, in Australia right now. And we watch that pretty closely because that's not perfect, but kind of indicative of what we'll be seeing in the Northern Hemisphere. Sadly, in only a few months from now. I know we're in the middle of a great summer, but fall is around the corner, and that's you have to prepare for that now.
Yeah, and for those that might not be up to date on all of their boosters, does it make more sense now to just wait until the fall until the newest booster is available?
So that's a tough question, because if we're talking at a population level in general, the answer to that is yes. And in fact, many provincial public health authorities have come out and said, you know what, many people can wait until the fall. Having said that, there might be individual circumstances, and there might be people who are at very high risk for severe infection who might not be able to wait till the fall. So I think it's important, if people have any questions about whether or not they should get a vaccine now or wait until later, it's important that they speak with a healthcare provider. I fully appreciate that it's sometimes challenging to see a healthcare provider. We know how difficult it is. Many people don't have a family physician, and some that do have a family physician have long wait times to get in. But remember, there's public health specialists, there's pharmacists, there's physicians, there's nurse practitioners, there's nurses. There's a lot of healthcare providers that can chat about vaccination and help walk people through individual decision making.
All right. Thanks so much. That is Dr. Isaac Bogoch joining us today with more on the recommendations to get a full COVID-19 booster. Have a great day, and thanks again for being with us.
Thank you, Sonia. You too.